Hello.
Hi.
Thank everyone so much for attending tonight. We're really excited about Ellacor, and we just think it's such a great way to educate all of you that are really interested in this new treatment. And so we are already getting lots of questions.
Yes.
So we are going to kind of get started. Okay, so let's see. Let's kind of start at the beginning here. Okay, so how frequently will the treatment be needed? So in general, it's recommended for most patients that you are going to want to do 2 treatments. And you can do those as soon as 1 month after the first, or you can wait 3 months. This is a new treatment, a new device. A lot of different dermatologists are doing things in different ways. And I think that we can kind of make a decision, on a case-by-case basis. But in general, 2 treatments for most patients. Some people may decide that they want to do more than 2 over time. There's really no end in sight to how many treatments you can actually do as long as you're still having improvement. And then how frequently will the treatment be needed? That's a very good question. And, I guess just as frequently as you feel like you want some more tightening. I know that there is a dermatologist who's done many of these treatments, and I've listened to her speak about it, and she thinks that this may be a really good treatment to do for maintenance. So, I may be doing it once a year or so. I don't know. But the nice thing is I don't think that there is a minimum or maximum amount of time that you can, do the treatment. So.
Okay, so another question. Can you have this done in an area that has filler underneath? So the answer to that would be yes. You can, but conceptually, you will be making full thickness wounds in the skin. So depending on the filler that you've had and what level of the skin it was placed, certainly you could lose some of that filler. But would it still remove your skin and tighten it? Yeah, it would.
Yeah, I think there might be a box on your screen. And so if you are interested in doing a consultation with us, then you can just click yes, and we'll be able to reach out to you. So you can hit that question. Okay, so let's see what's next. Okay, so as far as the collagen production goes, is there any benefit to waiting the full 3 months to see the maximum boost of collagen before the next treatment, or will doing the treatment earlier increase the collagen even more? I don't think we know the answer to that question at this point. So, I think when you do your first treatment, we do know that you do improve your, amount of collagen and elastin, and it keeps going up at 3 months. That doesn't mean that if we do the second treatment in a month, that halts that process. I just think I don't think one of those answers is correct. I think you can do it either way.
Agreed. Yeah. So what is included in the first treatment and what is the cost?
Oh, yeah. Okay. Yeah. Go ahead and you can take that.
So, in the first treatment, what do you think what they mean by what is included?
Well, yeah, that's a good question.
Kind of walking. So, in the first treatment, we'd always consult with you first to sort of think about like what exact areas are bothering you. Traditionally, people are treating like the lower face. So from like the preauricular area through the nasolabial folds around the mouth. And then we tend to go on the jawline a little below just to completely treat the area. And the cost for that treatment is $3,500 to do the whole lower face. And we have some specials that are available through this event.
Yeah. So, anyone that is interested in this treatment and you want to book a consultation to discuss it more, if you decide that you do want to go through with your Ellacor treatments, as long as you kind of purchase before the end of February, then it's 20% off. So for kind of like the on-label $3,500, you're going to get $700 off each treatment. And then if you do decide that you want to just purchase your 2 treatments, up front, then we're going to give you our exosome protocol, which is a $600 value. And exosomes are sort of the latest and greatest in wound healing and prepping the skin before the procedure and, giving you all the ingredients that are going to make sure that you have the best treatment possible and the best healing also.
Mm-hmm. Our patients have been really happy with the healing that they've experienced using exosomes.
Yeah.
Okay,
so we talked about the cost.
I think does it work for the dreaded turkey neck?
So, yes, it can. Obviously, on label is kind of this area. We can treat the neck. We can treat off-label areas. I've treated an abdomen. Anywhere where you have loose skin, I think we can treat with Ellacor. You want to talk a little bit about that too, or?
I mean, I think that, you're right on it. I think that anywhere that you have laxity, you're a candidate to use this device. It's safe to do.
Yeah.
And I think that the neck is probably an excellent, next place to use it.
Mm-hmm. I have a patient in particular who I treated the neck only and saw the patient back 2 months after we did the first treatment. And there was significant improvement in the firmness of the neck skin and just with the first treatment. So I definitely think that we can do this in other areas other than just kind of the lower face.
Agreed. How long do results last? So the results that you get are yours to keep. I think with any type of skin tightening device, or really any of our treatments that we do that are anti-aging to some extent, you do continue to age. So that's really we can improve, but of course, yes, with time you're going to age. And that's why we do some of these things, repeatedly years later or whatnot. But, the results last for as long, they're long-term results.
I mean, I think it's important to note, this is permanent removal of skin. The skin is gone, after we do the treatment, and then you get to make collagen and elastin, and some people may make more than other people. But this is really considered sort of like a permanent removal of skin. This is really exciting.
It's skin removal. It's definitive.
Yeah.
My girlfriend just got Kybella. How would you compare the two? It's a very good question. So they're really quite separate. So Kybella is an injection that is targets fat only. So it just basically dissolves fat. Whereas this device, Ellacor, removes the skin above the fat and tightens it. It's just different. Yeah. And they probably actually complement each other. Lovely. They'd be wonderful together, actually.
Mm-hmm. Okay. How does this compare to Evoke and Morpheus? Is it stronger? So obviously Morpheus and Evoke are using radio frequency energy. So, skin tightening is sort of the holy grail. You don't want to have surgery. What can you do to tighten the skin? And so we have all these energy-based devices like Morpheus Aid and Evoke and, ultrasound devices. But those all can tighten the skin to a degree. But I really kind of put Ellacor on a kind of the next level. Just because we are removing skin and tightening and building more collagen. And I believe that the DNA, the gene expression studies that were just recently kind of discussed at one of our meetings, it looks like the upregulation of collagen elastin is much more than you would see with some of these other energy-based devices. So I really consider it sort of next level. And I think there's a place for all of it.
Let's see.
Okay. Do you recommend more than 2 treatments? If you need more than 2 treatments, we will do more than 2 treatments.
I think that there are some people also with just certain changes in their skin, maybe really like deep fixed lines and more laxity, who probably would be surgical candidates, but certainly can do more than 2 Ellacors to eventually kind of get closer to where they want to be, for sure.
Yeah.
And do you have much swelling with this procedure?
Really, no. The most of the swelling you'll see the day of because of all the anesthesia that we inject. And I guess we can talk a little bit about kind of how we get you prepared for the procedure, because it's a very comfortable procedure. Most patients, in certain areas may feel, on average, they say a 2 to 3 out of 10 in discomfort. And the way that we do our kind of protocol is that we put numbing cream on your skin first, let that sit for a while. And then we're going to be doing some local injections of tumescent anesthesia, which means we're basically just injecting a lot of saline with a small amount of lidocaine. And that really does a great job in getting you very comfortable. If anyone's ever had Morpheus, this is so much easier than doing something like a radio frequency energy-based device. I could have taken a nap when Dr. Champlain did mine. You can have swelling that day, but afterward, you're not really that swollen. It's shocking how comfortable your skin feels. It looks like it would be so painful, but it's really not.
Let's see. Will this work for the smokers' lines around the mouth? Yes. Yes, it will.
Yeah. We'll be removing skin. We're going to be building new collagen and elastin. So yes, this is one of the areas that I think they didn't really realize that this was going to be such a nice treatment for the upper cutaneous lip, because it's reducing skin, tightening, lifting your lip. I had a patient that I had to ask her if she had lip filler because her upper lip looked just so much more rejuvenated after her first treatment, and it's just the procedure itself and just the tightening can improve the lips.
Just kind of removing the line and shortening the elongation of the line of the lip that happens with aging in everyone.
Yeah.
And it's so nice that we've only had resurfacing, which is great, but a really high downtime procedure. This is so much easier.
Oh, so much easier. Yeah.
Let's see. I'm sorry. We have a lot of questions.
I know.
We're probably not going to be able to get to all of them.
Yeah.
Oh, here's one about acne scars.
Okay.
So I'm 37 and have rolling boxcar and ice pick scars and some gelling. Would this help? Yes. Yes, it would.
Yeah. Will it help my cheeks from wrinkles? So we are not treating really off label at this point, above the jaw. Above the zygomatic bone right here. So we're not going to be treating, but lower face wrinkles. Yes.
Yes.
How many procedures have you done at Revival?
I've done quite a few now.
Yeah. I've probably done about 12 or so. How long do the results last? Treatment to do before Ellacor to prep the skin. Well, we do have exosomes. So if you do decide to purchase the 2 treatments, we have exosomes that you'll be using to prep the skin before. Will it remove the 11s between the brows? No, I'm not going to be treating that area. It's too high risk. Sorry. So again, how much does treatment cost? If you haven't been listening, the average cost for kind of on label is $3,500, but it's 20% off with the virtual event. Marionette lines. Oh, definitely will help the marionette lines. Can you get?
What is the percentage?
Okay, go ahead.
So what is the percentage of skin that is removed with each treatment? So that's actually customizable to the patient. Many people who use this device are doing about 5%. The device can go up to 10%. That's fairly aggressive, but you can customize it. So, like for example, I had a patient today that treated at 5% in her first treatment and healed wonderfully and was really happy and just wanted to be more aggressive in her second one. And we happily did that today and she did great. So,
yeah. Okay, let's see. Okay. Oh, right. Just a reminder, everyone attending today is going to be getting a text at the end of the event. And you just need to reply with the keyword DERM, DERM, to be contacted for a consultation. And so we'll contact you. You'll have a consultation. You'll meet with either Dr. Champlain or myself. Dr. Jacqueline, our 2 estheticians, Jacqueline or Jessica, will meet with you first. They'll go over any of your questions. They both had the treatment twice. They'll show you their videos and pictures and how the downtime looked and everything. And then we'll come in and talk with you.
Which I think we can get. And we're more than happy to, if you contact our office, meet with us. We have just so many questions. I don't think we're going to answer all of these, but we're so happy to talk to you about any questions that you have.
Right. Let's see.
Is there any fear of, this is actually a really important one, I think, because of Morpheus. So is there any fear of losing the fat in our faces with Ellacor? I've heard that Morpheus was causing fat loss in the face. So no, not with this device. And it's really all about the depth of penetration of the device, and Morpheus and this device are set differently. This device is really just set to remove the skin itself above the fat. It does not remove the fat. So you get to keep it because you want that.
Yeah. Right. Okay. So Okay, I guess I'm going to answer this last question. And how painful is this? And I know we kind of talked about this, but I do think I want to reiterate because if you go and you look at videos, if you go into our social media, Revival Dermatology, Dallas Derm, I have a little highlight. You can kind of see what it looks like to have the treatment done. It looks scary. But we, I mean, we're going to take care of you. It looks scary, but it's really, as a patient getting the treatment done, it's very comfortable. You know, we're removing skin, so there is some bleeding involved, but no one is bleeding when they leave. You know, the bleeding stops pretty quickly, and it doesn't hurt afterwards. You don't need pain medication. It looks like, you know, you have to do some wound care for a few days because you have lots of little tiny holes in the skin, but it does not hurt afterwards. And when you get the procedure done, it's very comfortable. So I know it looks scary, but it's actually, you know, it's good.
Yeah, exactly.
Yeah.
Right.
Okay. Well, thank you all of you for attending. We had so many people really interested in Ellacor, and we're so glad to kind of get the word out about this really exciting new treatment. And you'll be getting a text message. So don't forget, 3 of you are going to win our newest product, Habis.
Yeah.
And we're excited for you to come in and meet with us, and we can kind of make a plan for if we think that you're a good candidate, and get your treatments going.
And can we remind them what is the special for the event?
Right. So the special is 20% off of any treatments that you purchase. So if you think you want to do 3 treatments, if you purchase the 3 before the end of February, you're going to get 20% off of those treatments. And if you purchase at least two, then we are going to throw in the exosome protocol. So you're going to have your pre and post exosomes, which is a $600 value for 2 treatments. So lots of good specials because we really want, you know, everybody to try it out because we're really excited about it. I can't wait to do my second one.
I mean, neither. So I'm really excited about it.
Okay.
Thank you all so much for joining.
Yes. Thank you.
Thanks.
Okay. We hope to see you soon.
Bye-bye.
Bye.